Okay, so we're pretty much ready to begin. I think there's a number of people joining, so we might wait a minute or two, and then we'll get straight into it. Got a very full program, and really look forward to sharing with everybody this evening. So in starting this evening, I'd like to acknowledge the traditional peoples of the lands on which we meet and pay my respects to elders past, present, and emerging. I'd like to thank our event partner, the JNF, this evening, and our supporters from University of Tasmania, Rachel Kornhaber, Michelle Cleary, Alex Cilios from the Big Smoke, Hatzalah Victoria, the Department of Health, Sheba Hospital in Israel, and Mazel Tov for being voted hospital number 10 in the world, and the best hospitals in Newsweek recently. And a special welcome us to our moderator, Jill Margo AM. And welcome to all the community members, supporters, and everybody who's joining us this evening. Jewish House has worked around the clock over the past 12 months to immediately respond to the COVID-19 pandemic and the flow-on crisis that it was created. Overnight, lives have changed and normality seized. And the most basic events like grocery shopping, attending school, collecting medicines from local pharmacies, or visiting loved ones all changed. And we've worked together with government bodies, community members, organizations, help provide kosher food for people in hotel quarantine, people in nursing homes and hospitals, and working with many different organizations, including the COA and others. We launched our online mental health and well-being services to support parents, children, and those vulnerable in these changing times. And as Commissioner of the National Mental Health Commission here in Australia and a rabbi and CEO of Jewish House, it's been heart-wrenching experience seeing firsthand the impact of the pandemic on so many. But at the same time, it's been heartening to see the resilience and the human spirit important in the community and connecting and people connecting one with another. We continue to provide a safe place for people who are homeless with over 80 people per night. And we're slowly starting to see the rebuilding process, working together with people who need jobs, launching our jobs programs, help secure employment, and do whatever is necessary to help people through. We are lucky tonight to have with us the Deputy Chief Medical Officer, Professor Michael Kidd, who many of you have heard him answer questions and seen how he's working around the clock to keep us all safe. So thank you, Michael, for joining us. We also have Professor Gili Regev-Yochay and Professor Eyal Leshem from Sheba Tel HaShomer Hospital, who have been at the forefront of the rollout of the vaccine in Israel, where I'm told over 50% of the population has had at least one dose of vaccine, and over 40% have had both doses, and in the older populations, it's much higher. And to moderate this evening, we have our very own Jill Margo AM, who's one of the most respected journalists. Her work has won 20 awards, including 2 Walkie Awards. She writes for the Australian Financial Review and has published bestsellers in the field of biography and health. Most recently has been writing on COVID-19 and the vaccines. She's also a good friend, and we're really happy to have you with us tonight to help take us through the evening.
Thank you, Rabbi Castell. Good evening, everybody. Thank you for coming. Australia is in the very early stages of the rollout of the vaccine. This is the first time ever that our community has been so intensely involved in a vaccination campaign. Until now, most of us have routinely gone for our flu shots and our other shots. Now, however, we've got lots of questions and some of us are quite concerned. Tonight, with the help of the 3 experts, we're going to try and answer the questions that you've sent in. We all know that Israel has been a leader in vaccination, and tonight we have the 2 experts who've been at the forefront. Our first speaker will be Gili. Let me tell you a little bit about Gili before she speaks. Gili was wide awake in January last year and was among the first in Israel explicitly to warn the government of what lay ahead. How did she know? Well, in mid-January, there was a workshop in Germany for 30 people, one of which was a woman from China. When that woman got back to China, she didn't feel well, and it transpired that she had corona. By the end of January, 6 of the German participants had corona too. When Gili heard this, she told the Ministry of Health it needs to prepare for something entirely different. She understood immediately that if people without symptoms were contagious, this would spread like wildfire. Gili then helped the Sheba construct the first corona isolation compound in Israel, so infected patients could be treated separately without infecting other patients. Gili, over to you.
Thank you very much for the introduction. I'll put on my slides. And the way we'll do it, Eyal and I, is I'll give sort of an introduction on what has happened in the Israeli and Sheba, our experience in the rollout, and then Eyal will continue with the very nice and I think important results we have from some of the studies going on in Israel. Some of them are the Sheba Medical Center results. So let's start. Okay. So if we're looking at where we are, and this is really one of the nice places to be in, the first place in the world, okay, the highest doses administered per 100 people, the highest country is Israel. Somewhere above the 60 per every 100 people who are eligible for the vaccine, way over the UK, the USA, and other countries. And we're used to being first place in many things which are not as nice. And here it's really very, I think, really nice to see that, we achieved this. And what I'll try to give you in the couple of minutes I have is really how did we achieve this. So if we're looking, through up to the 6th of March, we have by now over 5 million Israelis out of 9 million Israelis altogether. And again, among these are children which are not eligible right now. So this is really amazing, a very, very high number. If we look at the different ages and we look at the over 60s, it's nearly 100%. It's above somewhere close to 90% of the over 60s population. By now, I think it's even slightly higher. This is from sometime like 2 weeks ago. And this is 1 dose, 2 doses, over 80% of the population of over 60s. And as I think Eyal will show, that immediately shows up in the results of how much disease we have. And we'll see that later. And if we look really at the age groups and the achievement of vaccination coverage, look at the older population, above 60, above 70, nearly 90% of these populations of 70, 80, and over 90, and that is where most of the infections, and obviously most of the severe infections, most of the hospitalized patients are or were in this age group. And right now, unfortunately, it's going down because these younger populations are still not vaccinated. We see in the green is those who received already 2 doses, and in the blue are the ones who got just 1 dose. And as you can see, the younger population typically gets the 2nd dose just a little bit later, and they're not as on time to get the 2nd dose. I think, and we don't have that data yet, but I think that the younger populations have slightly more adverse events, and that's part of why they're delaying their 2nd dose. But I hope that eventually we'll all get to the 2 doses, and that this will also grow. And then, we'll lower altogether the infection rate and the prevalence of COVID in Israel. So what are the keys to success of this Israeli vaccine rollout? And I think there are 4 main keys. We can discuss other probably issues that might also be advantageous to Israel. But I think one that I'll have to say or give a slide on is really the Israeli healthcare system. 2 is, I think, the way we opened, or the Ministry of Health opened it, and how they expanded the prioritization very early on. I think that has a role as well. Luckily, I think altogether we have a rather low rate of vaccine openings, while we do have them, and I've been blamed a lot of things on the websites as one of the people pushing for vaccinations. So I received a lot of, so they're very noisy and maybe voicey, but they're not a large amount. And I think that played some role in helping us to get a large proportion of the Israelis vaccinated. And then perhaps the point which many, and it was controversial on some of the media, is Israel part of Pfizer's real-world experiment. I see it for, the better. I don't mind to be a part of an experiment if it's this kind of experiment, giving us and allowing us to vaccinate and large proportions of the population to vaccinate. Some said, maybe this is not ethical, and there were a lot of controversies on this. I'll maybe show one slide on that. So if we're talking about Israel's healthcare system, we have a national health insurance law. Every legal resident receives all medical care with very low co-payment. Medical coverage is universal, independent of employment status, place of residence, or tax payment. And there are 4 large HMOs that provide the community-based medical services, and fully digital electronic medical record system is the rule in all of these. I think that really played a role. Everybody was able to get their vaccine on time. The second thing is the prioritization. Very early on, from the beginning actually, there was a large or expanded prioritization, including all of the healthcare workers. It was not only those in ICU. Whoever wanted could get it. And it took time. If initially some of the people were still afraid, once they saw that more and more people are getting the vaccine and there are very low adverse events, I think that sort of was what played a role in all of this. And then, as I said, the fact that Pfizer actually gave a lot of the amounts of the vaccines were just, as many as we wanted. We didn't have any problem of availability of the vaccine. I think that probably also played a role. And as you can see, we had queues for vaccines. And I'll say 2 or 3 words on the Sheba Medical Center healthcare worker vaccination, how the campaign and the rollout were successful. This is what we're seeing by like 2 weeks ago. And as you can see, the first dose very rapidly, we had within a few weeks, nearly 80% of the healthcare population received the first dose. And then 3 weeks later, very rapidly, the second dose. And right now, and I'll show this here, we have whether it's MDs who have above 90%, and we're aiming at 100% of the MDs to get the vaccine. Of those who received the first dose, nearly 100% received the second dose. Paramedical also very high. The place where we're still having a little bit of trouble is the nurses, and less so the administration personnel. But our aim is to achieve within a few weeks or month or 2 to really achieve the 100% vaccination coverage. And I think the campaign was very successful, with actually the Prime Minister Benjamin Netanyahu being vaccinated at the Sheba Medical Center on the first day of the vaccination rollout on the 19th of December. And this is where it all started. These are the newly detected cases in Israel, the daily newly detected cases. And as you see, as the first vaccine was given, that's exactly when the third surge really started increasing. And maybe that had a role as well, because once you see increase in infection rate altogether, and more and more people who are now in the hospital, I think the fear also played a role, and people went and got vaccinated. You can prevent this, and I think that definitely played a role. And with that, I'll stop. I think we can stop this pandemic. We need to get vaccinated, and I'm very happy and proud that in Israel this really succeeded. We'll see how it plays a role in mitigating the pandemic altogether. I believe it will. And with that, I'll give Eyal the
Thank you. Thank you, Gili, very much for that. Very interesting. Viewers, Gili has to leave, unfortunately. Something more urgent is calling her. But Eyal will remain with us to answer some questions. Gili, go safe, and thank you very much. Now, our next speaker is Ariel Lesham. Eyal has two passions in life. One is travel and one is infectious diseases. And in his job, they combine beautifully. He's worked across the spectrum and from remote places like Kathmandu to the enormous CDC, Center for Diseases Control in Atlanta. He's also been to Australia, I might tell you. He's, as a seasoned traveler, he thought he could bounce into Melbourne for 3 nights and then bounce home and go to work the next day. He never knew what we all know about our particular brand of jet lag. And I think he classifies his recovery from the Melbourne trip as the worst on record. Eyal, please tell us what the figures that have emerged from the Israeli vaccination program show, what they tell us now, and what hope do they bring for the future? Over to you. I think you're muted.
I think now I'm not, and
Yes.
Let me share my screen again. Okay, so everybody can hear me and see my presentation. Excellent. So I'll start where Gili finished, and this is our situation this morning in Israel. Out of 9.2 million Israeli citizens, 4.9 received the first dose, 3 million are children, so not eligible, nearly 800,000 already infected. And if you look at the table, really what you want is the green rows that depict protection, percentage covered and percentage fully vaccinated and percentage recovered from those that are aged over 50. And you see we have 85% that are fully covered 1 week after the second dose, and 89% if you include those that have recovered. So all in all in Israel, we have only 281,000 people that are not vaccinated, neither recovered from the disease. And this puts us in a very unique place globally, because we can actually measure both vaccine impact and effectiveness. And what I will share with you is some scientific data that emerges from Israel that kind of shows the world what things are going to look like over the next few months for other countries that receive high vaccination rates. Now, the first pieces of data emerged from Weizmann Institute. It's a group of mathematicians. And what they did is they looked at vaccine impact in groups that are vaccinated compared with the people that are unvaccinated. So what you see in these panels, that there are 6 panels, A through F. On the bottom, on panels E and F, you can see the proportion or the percent that received 1 dose, and then on a darker 2 doses. On the left on E, it's persons under 60, and on the right, persons over 60. And what you can see is that according to our prioritization, quite early, persons over 60, there was a high proportion covered. Now look at panels A through D. What you see on the dotted line, the dotted vertical line, is when we went into our third lockdown. And then within a week, you can see how the number of cases peak and then they start drop. However, the two lines separate. The blue line, which are persons over 60, this line continues to drop as they become more and more vaccinated, as the proportion that's protected gets higher and higher. Whereas the orange line, which is the younger persons that were still with a very low coverage rates, goes back to rising. Now panel A is all positives, panel B is moderate to severe, then C hospitalizations, and D severe hospitalizations. So you see that the number of hospitalizations and severe hospitalizations continues to rise in the uncovered people, even though they are young, which tells you there was substantial transmission in the community, but those over 60 were already protected. Now, this is what we call an ecologic analysis. It doesn't look at a specific patient to see whether or not they are vaccinated. So moving on, what they also did, jumped a few slides, going back. What they also did is they looked at vaccinated and compared it with early vaccinated compared with late vaccinated cities. And in a nutshell, what this means in Israel is that in Israel, there are cities that are almost 100% populated with either ultra-Orthodox communities or Arab populations. And in these cities, unfortunately, the level of coverage in entire population and also in persons above 60 was slower to rise. These were more hesitant populations. And when on the left, in the early vaccinated cities, we see the green line of persons over 60 dropping after the lockdown. In the right side panels, we see in the late vaccinated cities, the separation between the two lines. The red, which is persons over 60, was later to occur. So it took longer for this critical mass of persons over 60 to be vaccinated and for disease rates to drop. Another ecologic analysis looked only at mechanically ventilated people and compared those that are mechanically ventilated and aged over 70 with those that are mechanically ventilated and aged under 50, the young people with severe disease that need mechanical ventilation. Now on the top panel, you see again the proportion of the vaccine coverage rate. And you see how quickly it rises in those that are over 70, that are vaccine eligible. Those are the black empty bars and the black full bars for 2 doses. Whereas on the light blue and dark blue, the proportion of coverage in persons under 50. And again, on the bottom panel, you see the lighter blue bars are those over 70 that are mechanically ventilated. They go back to rising in December when we have our wave, but they plateau, the number of mechanically ventilated plateaus at the end of January and starts to decrease. While in the blue bars, the number of mechanically ventilated under 50 years old, young people with severe disease, continues to rise throughout January and early February. And in the full black line, you see the proportion. So dividing the number of over 70 by the number under 50. And you see how this proportion drops. It means that the representation, the number of people over 70 severe cases sharply declines once we reach a high coverage. These are data that were released by the Israeli Ministry of Health over a month ago, 6 weeks ago nearly, at the end of January, and they looked at fully vaccinated people. At that time, we only had 1,100,000 fully vaccinated, 743 on the left 743,000 are aged over 60, and 387,000 are younger. And they looked at COVID cases in fully vaccinated. And you see there are quite a few COVID cases. These are 500 in this population of above 60. 500 were infected. However, if you go further to the right, you see that even though they were older, aged over 60, because they were fully vaccinated, 480 were not even hospitalized. And the 27 were hospitalized with mild to moderate disease, and only 21 severe or critical disease, and only 3 deaths. So people may still get infected while vaccinated, but they don't end up developing a severe disease. In the younger population, even more apparent. 158 are infected. 258 infected, but 253 not even hospitalized. Only 5 are hospitalized. So really a very effective vaccine. These are data from MOH, and later they tweet effectiveness data using similar data. They tweet this mid-February, and again, they show effectiveness for both preventing infection, preventing severe disease, hospital admission, serious disease, and even death. All these are apparent at least 1 week after the second dose. We at Sheba had a smaller data set. We only have our 9,000 healthcare workers. However, we were able to use this data set to be the first in the world to publish real-world vaccine effectiveness of COVID vaccine. And what this means is, normally the data we have come from randomized controlled trials, but sometimes vaccine perform differently when you use real persons. And what we did is we rapidly analyzed our data from these 9,000 Sheba workers vaccinated over the months of end of December and early January. And we sent it to the Lancet, and the Lancet was particularly interested because the UK still uses a single dose with a longer interval. So our question was, how effective was the first dose, which you see comparing unvaccinated. When we look at days after dose 1, we see that between days 15 and 21, we had a 65% reduction in all positive cases and a 76% reduction in symptomatic cases. And this continued to rise to days 22 to 28, where we had even a higher protection. However, some of these already received their second dose, so some of this impact is attributable to the second dose. But clearly a good effectiveness. Early on the 3rd week after your first dose, you're very protected. So we were the first to show these numbers. This is pool data for the 2 weeks. Again, very similar numbers. They got a lot of interest globally. And then a week later, the Clalit Health Services published the largest to date data set of real world effectiveness, looking at 1.2 million Clalit insured persons, and showed very high effectiveness across outcomes and across age groups for both infections, symptomatic, severe hospitalizations, and even death.
Eyal, can you summarize for us in a general statement how good the vaccines have been?
Well, I think the general statement is, if a week has passed from your second dose, you are probably more than 90% protected from both becoming infected and even a higher protection against developing severe disease. Until then, there are some rates of infection and some do develop symptomatic disease. But even the first dose provides reasonable protection. And I expect data from the UK to emerge very soon. I personally have been involved in reviewing some of these manuscripts that are going to be published, I think, soon, about effectiveness of a single dose of both Pfizer and AstraZeneca. And we will see that even a single dose provides substantial protection.
Can I ask you, do you have any doubts at all about the vaccine, about the safety of the vaccine or the effectiveness of the vaccine?
I want to finish and then we can discuss safety.
Okay.
have another presentation
Out of time.
that's of interest, but let's keep be mind to our time. And I do have some slides about vaccine safety if you are interested. So moving on to our conclusions. In Israel, we saw high coverage of population at risk. We do have some challenges, which we anticipate everyone around the globe to encounter. These involve special populations. In Israel, there were some ultra-Orthodox communities and some other minorities. And of course, there's the challenge of getting the younger and healthier vaccinated because they are not worried. The risk of severe disease is low. You see on the right from Sky News an interesting initiative. You just go to where the people are. They went to bars and they gave a free beer to anyone who would agree to get the vaccine. I think this could also work in Australia. Correct me if I'm wrong. But in reality, you need to tailor your communications and to tailor your approach to hesitant communities. They need to be culturally tailored. Another comment, in Israel, the predominant variant in January 21 was the UK variant. So our effectiveness data is relevant to the UK variant. We are seeing cases of the South African variant, but not a substantial proportion. And our effective analysis, as mentioned earlier, highly effective after the first dose and even more effective in fully vaccinated. And I was asked to add this slide and tell our audience that Sheba has a Friends of Sheba branch in Australia, and Idan Goldberger is our representative. If there's anything we can do to help, or if you're interested to hear more about Sheba, please contact Idan. And over back to you, Jill. Thank you for the opportunity. I'll wait to take questions.
Thank you, Gili. Before I move to questions, I think I'm going to ask Professor Michael Kidd to talk to us. Thank you very much. Professor Michael Kidd is an extraordinary Australian. He's the Deputy Chief Medical Officer, and he's held too many high positions for me to recount. But I will tell you, he's the past president of the Royal Australian College of General Practitioners, and a past president of the World Organization of Family Doctors. On the side, he's written 18 books, that's 18 books, about doctors, for doctors, on health, on well-being, and of course, on infectious diseases. Michael has an apartment in Sydney, but of course, last year he hardly saw the inside of it because he was in the cockpit of the nation's COVID campaign in Canberra. And today he's speaking to us from South Australia. Michael is going to tell us about the rollout in Australia, what you need to know about being vaccinated, where to go, how to find out, and a lot of details that many of you have asked about. Over to you, Michael.
Thank you, Jill, and thank you so much for inviting me to join with you tonight. And I just wanted to start off by saying a huge congratulations to Gili and Eyal for the work that they are doing and for the work that Israel is doing in combating COVID-19. The world has been watching very closely to see what has been happening with the rapid rollout of the vaccine in Israel. And it has been so exciting to see that fall that we've seen in those graphs, the fall in the number of people being affected with serious disease, the fall in the number of deaths, the fall in the number of people being hospitalized and admitted to intensive care units. And thank you so much for sharing that with us. Australia, we're just 2 weeks into our national vaccination program. And already over 80,000 people have received a first dose of the Pfizer vaccine, and that includes over 25,000 residents of residential aged care facilities and disability care facilities right across Australia. As people are probably aware, we're starting off our vaccination program with people in what we're calling Phase 1A. And Phase 1A are the people who are most likely to come in contact with COVID-19 in Australia. These are our quarantine workers, people working on our borders, our healthcare workers who would look after someone if they're infected with COVID-19, and the people who are most at risk of serious disease and death from COVID-19. And that, of course, is our aged care facility residents, the residents of disability care facilities, and the people who are working in those facilities. We anticipate that moving towards the later part of this month of March, all those people in phase 1A will have had the opportunity to receive the first dose of their vaccine, and then 3 to 4 weeks later, they'll receive the second dose and get that level of protection which Eyal was describing to us. Towards the end of March, we'll be starting with phase 1B. And phase 1B involves 6 million people in Australia. It will be everyone aged 70 and above. It will be Aboriginal and Torres Strait Islander people aged 55 and above. It'll be everybody else working in healthcare settings, hospitals, general practices, primary care settings right across the country. And it will be people with a number of chronic health conditions or disability, which put them at increased risk of serious disease if they were to contract the coronavirus and develop COVID-19. And this includes people who have or have had cancers, people with diabetes, people with significant obesity, people with serious heart disease, serious lung disease, and a number of other conditions. From the end of the month, we'll be starting to roll the vaccine out through general practices right across Australia. We put out an expression of interest to Australia's GPs to see who would like to be involved in the national immunisation program. We thought that we'd get about 1,000 general practices across Australia who would put up their hand. We actually received more than 4,500 general practices putting in an expression of interest. So we will be rolling the vaccine out through those 4,500 general practices right across the country, with some of the practices starting at the end of March and others coming on board over the subsequent weeks. The vaccine which will be offered through the general practices will be the AstraZeneca vaccine. This is the vaccine which has been rolling out in the United Kingdom to great effect. And at the moment, we are receiving our vaccines from overseas. We've received 2 shipments of the Pfizer vaccine, 1 shipment of the AstraZeneca vaccine. But from the middle of this month, we will be producing the AstraZeneca vaccine in Australia through CSL in Melbourne. And by the end of the month, we expect that CSL will be rolling out 1 million doses of the AstraZeneca vaccine each week. And what this means is that we're going to be able to progressively vaccinate the population of Australia between now and the end of October of this year. We're expecting very high levels of uptake of the vaccine. Australia is a country which has very high levels of vaccination. We have up to 95% of our children completing their childhood immunisations in Australia. And last year we had over 19 million people who were vaccinated against influenza. Again, the vaccine delivered by general practices and pharmacies right across the country. So this is a very exciting time. It's a very exciting program. There's lots of people behind it. I guess one of the questions, Jill, that people want to know is, how will I know when it's my turn to get the vaccine? So clearly, we're going to be talking in the media about which phase we're up to and which group of people in the population are eligible to get the vaccine at this time. But on the Australian Government Department of Health website, health.gov.au, I've said that a few times in the past year, health.gov.au, we have a vaccine eligibility checker. And you can go on and enter your details and find out which group you're in for receiving the vaccine. We also will be putting up onto the health.gov.au website over the next week or so, the national booking service, where you can go onto the website and you can find out again when it's your turn to get the vaccine, and then you can find out where the vaccine is being delivered in your part of the country. in your suburb, in your town, wherever you are in Australia, and the details where you can make an appointment to get the vaccine. I think it's very important that people recognise that this is a phased approach, and so you may not be able to get the vaccine in the first week that your category starts receiving the vaccine. It may take a few weeks before you can get an appointment. But the good thing in Australia is that at the moment we have no community transmission. The cases that we're seeing amongst return travellers coming into Australia who are in quarantine. And because we're vaccinating the quarantine workers, we're much less likely to see outbreaks occurring from breaches in the quarantine system, as we've seen happen over recent months. So this program that we have is actually vaccinating those people to protect the entire population. I think the final thing I want to say before we move on to the questions is, if you're thinking about getting the vaccine, please do. We must all be part of this. It's incredibly important. Getting the vaccine doesn't just protect you and your family members, it protects everybody in Australia. And so we want everybody who is in Australia to get the vaccine. And that includes people who are not Australian citizens, but who are in the country at the moment. There are about 1 million people here on visas, people who are visiting when the borders are closed, people on student visas, people on working visas. Everybody is eligible to get the vaccine. If you have a Medicare card, you can get it through your general practice. If you don't have a Medicare card, you can get it through the state and territory vaccination centres or through the general practice-led respiratory clinics that the Australian government has set up. We've set up 150 of those right around the country.
Thank you very much, Michael. It was very useful information. Eyal, I want to ask you a question. Do you have any doubts at all about the vaccines? Is there anything in your mind that makes you think twice or that people should be concerned about?
I will start by saying probably your first lesson in medical school is the first rule in medicine is primum non nocere, right? Don't cause any harm. And then the second lesson is cum granum salis, everything with a grain of salt. So we have to be modest. We have to do robust surveillance of adverse events. Look at these persons who get vaccinated. Look at the background rates of disease. When you immunize millions and millions of people, events are bound to happen because millions of people get the vaccine. And we know there are several thousands of heart attacks every month. Then some of them will receive a heart attack after getting the vaccine. It still doesn't mean there's an adverse event. And then remember that good public health is based on robust surveillance, and public health decisions are taken using data and not temporal associations. So, oh, I heard about the neighbor of my sister that had a headache after the vaccine. That's not public health. We have millions of people we'll set our surveillance. So Israel is not large. We have not seen any signals of severe adverse events after the vaccine. We are seeing a lot of pain and local pain and redness. We are seeing some cases of weakness, of fatigue, sometimes chills and even a brief fever, especially after the second dose. None of this is considered severe adverse event. None of this brings to hospitalization. When we look at severe adverse events, we've not seen. And I will add to that Israel is a little bit small, but the American CDC, which I'm well familiar with, I've worked there for 3 years, conducts very, very robust surveillance using several tools, looking in these vaccinated and unvaccinated. And I have some slides from what they are publishing, and they are not seeing any signals on the Pfizer vaccines, on the Moderna, which is available. They've not seen any signals for severe adverse events either. And perhaps it would be of value to hear Professor Kidd mentioning what kind of adverse event surveillance Australia is planning.
Well, but before I go to Professor Gili, I want to ask you a question because I know your time is short. A lot of the questions that came in advance of this evening were about age and about the effectiveness of the AstraZeneca vaccine compared to the Pfizer vaccine in people over 65 and in people 75. We've all seen publicity from Europe where they've got large amounts of AstraZeneca vaccine not being used in older people because they were waiting for some further evidence. In Australia, the view is that it's perfectly safe and perfectly effective in people over 65, and that the differences between Pfizer and AstraZeneca are small and may even disappear with time or reverse with time. So first of all, on the question of age, what can you tell me?
Again, I always like starting with safety. So with the caveat that we've not used AstraZeneca in Israel, all I'm seeing is what I'm reading mostly from the UK, and there are what we call preprints from the UK looking at AstraZeneca vaccine effectiveness. So this is what I will comment. And I'll start by safety. We're not seeing any safety problems or differences with the AstraZeneca vaccine. And looking the effectiveness, the right way to look is really to observe the real world data that emerges as we speak from the UK. And I expect within a few weeks, we will all be able to read about AstraZeneca vaccine effectiveness in the UK and be reassured that it provides very good effectiveness against severe disease and hospitalization. But again, these data are emerging. I think it's wrong to look at the point estimates. People that come from a non-scientific data think that 75 and 92 are very, very different. But as scientists, we really need to look at the population that was studied and look at what we call the confidence interval, not at exactly the point that was reported, but how wide the interval was. And sometimes the confidence interval overlaps, which means statistically the vaccines performed exactly the same, most probably, or slightly different. So the real world data will really determine, but I would feel very reassured if my parents were able to receive AstraZeneca and not the Pfizer that they got. I would still feel very, very relaxed.
Thank you for that. And what about children? What about the vaccination of children?
Well, we know that Pfizer is right now conducting an assessment of vaccine safety and effectiveness in adolescents aged 12 to 15. There is, I think, a Moderna study planned for, or even started rolling for age 1 to 15. So these data are expected to emerge over the next months, perhaps in early next year. Until then, Israel is considering vaccination of children aged 12 to 15. Now, physiologically, there really is no reason to think that the vaccine will be unsafe in younger children. That's why we are assessing it. We've already vaccinated several hundreds of kids that age that have pre-existing conditions that make them susceptible to severe COVID. So weighing or balancing the potential risk of a non-safe vaccine with the actual risk of contracting corona and getting a severe disease, we went ahead and vaccinated these kids and didn't see any adverse events. So based on this, I think we will have a decision within the coming months to vaccinate the older kids. With the younger, it will wait because they also normally don't suffer from severe COVID.
And what about people who are immunosuppressed, immunocompromised, have chronic diseases? What should they do?
That is an excellent question. Generally speaking, the vaccine is safe. It is safe even for people that suffer from chronic diseases. It is even important for them to be vaccinated because they are at the risk group for developing severe COVID. Regarding the effectiveness, this really depends on a specific patient, and I will urge people that have any question about how effective the vaccine will be and how protected they will be after receiving the vaccine to consult with their doctors. But it is certainly safe for everyone. So in Israel, we recommend everyone to get the vaccine except for very specific, what we call contraindications, people that have suffered very, very severe allergic reactions, immediate reactions to previous vaccines. With them, we are a little bit more cautious.
So people who've had allergy in the past,
no.
What should they do?
No. If you look at a normal primary care clinic, you'll see about a third of patients in Israel have something under their allergy label. These people can be very relaxed. They will need to ask their physician, but for 99.99% of these people that have an allergy, it is perfectly fine to be vaccinated. There is a very particular population that suffered very, very severe allergies that brought them to an emergency room. They had to get shots of adrenaline and be hospitalized. This population may need specific care when they get the COVID vaccine. But for most others, it is perfectly safe.
Right. Thank you very much. So people want to know how long the protection will last after they've had their 2 shots. And should they expect a 3rd shot? And will this be like a flu vaccine that you have an updated version year in and year out? And eventually, the whole of the COVID sort of recedes into a disease that we live with.
There's a famous proverb, I think, by Niels Bohr, the physicist, who said predictions are difficult, especially about the future. So it's very difficult to predict how long protection will last. However, we know other vaccines. From the kinetics of the antibody response we're receiving and from the effectiveness we're seeing, we have good reasons to think that protection will be long-lasting. We know for now that we're seeing robust antibody responses for up to 8 months, but we've only started looking at this disease a year ago. Other vaccines produced longer responses. The other question about protection is, will we see what we call variants that emerge that may reduce current vaccine effectiveness? And this question, again, so far we've not seen any impact of the UK variant, and in other places, vaccines seem to be effective against most variants. But this data will have to be, again, monitored using very good, robust surveillance, continuously looking at the types of virus that we are seeing and making sure the current vaccines are effective. And if, God forbid, there is one variant where the vaccine is not as effective, these, at least the mRNA vaccines, are very easily tweaked to cover, to change their molecular structure, and can be used as a booster to induce effectiveness against other variants. So we already
if you haven't had an mRNA vaccine, which are Pfizer and Moderna, if you had an AstraZeneca and variants come in, and variants are currently surging in Europe, can you have a Pfizer booster after having an AstraZeneca shot, 2 shots?
We don't know yet. We know from other vaccines that we use 2 types. We've used 2 types of vaccines against various diseases. Polio is very famous for that. We use the oral drops vaccines and the shot, and they give us complementary protection. We also know pneumococcal, what we call pneumonia vaccines, where we use 2 types with very good effectiveness from 2 mechanisms. And we may end up using this mechanism also for COVID. But we really have to be very patient and provide these resources for our public health professionals. And I'm well familiar with the public health professionals in Australia. I know you're in very, very capable hands. We will be able to continuously assess the situation and provide solutions. I will add that if a year ago, back in March, somebody would tell me that in March of 2021, I will sit here with my parents and myself vaccinated with a highly effective and safe vaccine, I would tell them this is the most optimistic scenario I can even imagine. So people need to be optimistic. We're in a good place. This is really a triumph of science, and it's trusting the system and collaborating that will help communities emerge from this crisis.
Right, trusting the system. Very good. So Israel allowed itself to be a kind of petri dish for Pfizer. They said we'll give you all our data. We'll take out the identities and we'll give you the data. And that was a negotiating tool, I understand, to get Pfizer. What is the attitude? I mean, has any other country offered their data up in this way? And what was the attitude of Israelis to this negotiating tool and to this exercise?
With all modesty, I will rectify your statement.
Please.
Israel really wanted to be able to vaccinate as many citizens as possible, as soon as possible, once we've seen a clinical trial of 40,000 people shows that the vaccine is safe and effective. So this was a reasonable decision. In the agreement, which I have not seen, it's not unveiled, what my understanding is Israel agrees to provide Pfizer with what we call aggregated de-identified data, which means we will give you the data in a way that you cannot trace it back to specific patients, but you are able to assess the effectiveness of your vaccine. And in this sense, pharma sometimes is viewed as the great devil. First, and disclaimer, I have no conflicts of interest to declare, and I'm a government worker in Israel. Pharma are sometimes seen as the great devil, but really without pharma and their resources, the research and their production, we would not be in this place. So absolutely. I don't see anything wrong with an agreement that where Pfizer tells Israel, we'll give you millions of doses to cover everyone, and the Ministry of Health says, okay, and we'll give you de-identified aggregated data, and you can look at what your vaccine does in specific populations. Perhaps it will help both Pfizer produce better vaccines and the rest of the world understand the vaccine impact. So personally, I don't see hesitancy, but this needs to be communicated and transparent. And maybe that's the angle that maybe could be improved.
Right, okay, thank you. I know you have to go in a few minutes. My final question to you was sent in by one of our listeners. Person wants to know how vaccines will affect, if vaccines will affect fertility. They haven't been around long enough to last the 9 months to see the effect on a child, on a baby. And what about these vaccines in pregnancy? Fertility and pregnancy.
You asked two questions. We'll start with pregnancy. In Israel, when the virus was raging in February, we've seen dozens of severe cases in pregnant women that lost their lives, women that lost their pregnancies. And we've had good experience with other vaccines in pregnancy, vaccines that do not contain a live virus. The Pfizer vaccine doesn't have a live virus. We actually recommend that pregnant women are vaccinated against pertussis and against influenza. And we've never seen any problem. There's no physiologic reason to think the vaccine are danger to pregnant women, and therefore we recommend vaccinating pregnant women in Israel. To the fertility issue, the modern world had used dozens of types of vaccines in billions of persons, in billions of men and women, and we've never seen a signal of any effect or impact on fertility. And these are good, robust epidemiologic data because many countries have good data sets allowing them to compare vaccinated with unvaccinated women, looking back for years and so on. And the COVID vaccine is no different. We don't see any reason to suspect it will affect fertility. We recommend it to young women. To the contrary, suffering from severe COVID, scarring your lungs, suffering from long COVID could certainly have a substantial impact on a young woman's fertility. So my recommendation, and as it is in my family, all young women, it is recommended for them to get vaccinated, and I feel very comfortable with this recommendation.
Thank you very much, Eyal. It's been marvelous having you tonight. I know that you have to go, and regretfully we say goodbye.
Well, thank you for the opportunity. and it would have been fascinating to hear more. I will try and keep stay posted from what I read about Australia, and please don't hesitate to contact us in Sheba with any questions, and thanks for the opportunity to present our data.
Thank you very much. Shalom.
Bye-bye.
Michael, I understand that this, can you talk to us about fraud in the vaccine space? You know, people getting false invitations, apart from, we've seen, you know, fake masks, we've heard about fake vaccines, and now we're hearing about fake bookings and people giving their, can you talk about this? What is the problem?
Yes, look, there's going to be people who are going to try and benefit from other people's fear. And we've seen this happening throughout the pandemic, and it's despicable that people would do this. We've seen fake vaccines being released onto the market in some countries, which is very alarming and very concerning. That won't happen in Australia because every vaccine has to go through the Therapeutic Goods Administration process. We've also seen overseas people ringing up people and saying, you know, you're eligible to get the vaccine and you can pay for it and give us your credit card details and then we'll tell you where you can go and get the vaccine, and this is awful as well. Again, that won't happen in Australia because we're not charging people for this vaccine. This vaccine is free of charge in Australia, and when you go to get the vaccine, you won't be charged either. If you go to your general practice, you'll be bulk billed through Medicare. If you go to one of the state or territory or Commonwealth clinics, you won't be charged either. So hopefully we won't see those sort of problems occurring here, but we are seeing them overseas and it's alarming.
Thank you. So in what you were saying earlier about knowing when and where to go, I understand that if you don't belong to a general practice that's going to be giving these vaccines, your general practice, if you belong to one, will likely contact you. If they don't contact you, you shouldn't sit around and wait to be contacted by a government official because it's not going to happen. It's like the flu vaccine. Nobody phones you up and says from the government, from the health department, says go for your flu vax. It's up to you to take the initiative, to go online and to book and to find a way of getting it. So I think that some people wouldn't have known that. They would have waited to be contacted.
So you're right. So we'll have well over 4,000 general practices which will have the vaccine available, and then we'll have approximately 2,000 practices which won't. So you may not know whether or not your general practice is offering one of the vaccines, but you're able to make an appointment at any general practice which is rolling out the vaccine, or you're able to make an appointment at one of the state or territory or Commonwealth clinics. So,
and these are all for the AstraZeneca. These aren't for the Pfizer.
Look, you may get one or other of these two vaccines, and there's a third vaccine coming down the path as well, the Novavax vaccine. So it's likely that each setting will only be offering one type of vaccine, and we're doing that because we don't want to get confusion, because they're handled differently, and we don't want errors occurring. So basically you'll get the vaccine that's available at the place where you make your booking. The good thing is though that the data is very strong now, Jill, that all these vaccines are equally effective and are equally strong in protecting people. We had some concerns about the AstraZeneca vaccine earlier on, but further research has been released and carried out. Big trial reported in the Lancet Medical Journal at the end of February showing effectiveness of the AstraZeneca vaccine, very similar to the Pfizer and Moderna vaccine. Germany, which was not recommending the AstraZeneca vaccine for over 65s, this weekend has changed their position and now is recommending the AstraZeneca vaccine for the over 65s. This is based on the research data, but also what we're seeing around the world, as Eyal was saying. We've now had well over 220 million people receive a first dose of one of these vaccines, and we're seeing the benefits to the community, even with that initial dose.
Thank you. We've a few of our questions. A few people asked questions, and they wanted to know why it took Australia so long to get going with the vaccines.
Yeah, it's a really important question. So most countries overseas which have had the vaccine earlier than Australia have done that under emergency provisions. They haven't done it under their usual regulatory approach. They've done it under emergency provisions. And that's because COVID-19 at the end of last year was raging out of control in many countries, including Israel, of course, with hospitals being overwhelmed, with large numbers of people getting serious disease, with significant numbers of people who were dying. That's not the situation in Australia. We've been able to go through our regular regulatory process. It's been faster than normal, but it's been as thorough and as rigorous as it is for any new vaccine or any new medicine administered in Australia. And that's why we've taken a little bit longer than elsewhere. Of course, with no community transmission occurring in the country, we're not in the same position as some other countries. I think we saw late last year in the UK, they vaccinated large numbers of people and then they ran out of vaccine and they couldn't give people the second dose at the time it was due. The emergency situation was so dire. Again, here in Australia, we are keeping back doses so that we can make sure that everyone gets the full dose, the full two dose course.
I wanted to ask you, we were due to get some vaccines from Italy and they decided to keep them for themselves because their situation is so dire. And the Italians said, it's okay, well, we'll withhold from Australia because Australia is not vulnerable at the moment. Australia is a safe place. Now, I want to challenge that. I think that it's half right and half wrong, because I think that we've had very few cases, so we've got very little natural immunity. We've got very few people vaccinated, so at the moment we're almost sort of tinder dry. We've got and should one of these aggressive variants come through the border, come through quarantine, it could spark a bushfire. So although we're safe and we're happy and we're in a kind of cage, we're all locked in and it's pretty safe, we're also quite vulnerable, we're quite exposed. I understand that why Italy kept the vaccines, because the vaccines are more useful in that environment than they are here for the moment. To say Australia, we should just open our borders and we're not vulnerable, is not correct, is it?
No, not at all. And look, no country has achieved what they call herd immunity to COVID-19. No country has had the percentage of their population infected with the virus that would lead to natural herd immunity. And we don't know what herd immunity is with COVID-19 anyway, because as Eyal was saying, we don't know how long natural protection after you've been infected lasts. We know that there are people now who were infected this time a year ago who are getting infected again, sometimes with new variants. So there's still a lot which is very unknown. We do have a degree of protection in Australia while we have the international borders being as secure as they are. We now have that added layer of protection with the quarantine workers and border force workers receiving the first doses of the vaccine. But you're right, we're still vulnerable. And this is why it's so important that when it is your turn to get the vaccine, that you roll up your sleeve and you get it. And that way we get to protect everybody.
Are we going to get vaccine passports? Once I'm vaccinated, am I going to get a passport that'll let me go to Israel or wherever I want to go?
Well, look, there'll likely be different restrictions put in place by different countries about whether people can travel to their countries or not. I don't know if we're going to get vaccine passports. Again, there's a lot about this disease and these vaccines we don't know. What we do know is that the vaccines are very effective, as Gili and Eyal have said, in protecting people against developing serious, severe disease. But you may still be able to get mild disease and you may still be able to get asymptomatic infection.
Well, can we talk about that? Because everybody talks about when you talk about the vaccine, we talk about it's safe and it protects against severe disease, but doesn't protect against moderate to mild disease. And moderate to mild disease may open you to this thing called long COVID, where you have these symptoms that sort of stretch out like a post-viral fatigue or whatever it is, and I don't know the other complications. So let's talk about, everybody wants to be protected from severe disease, but I don't really want mild, moderate disease either. And why don't the vaccines protect against, why do they protect against severe and not moderate? It doesn't make sense.
Yeah, so the vaccines do offer a significant degree of protection against mild to moderate disease, and it's at least 60%. It may well be more than that after people have had the 2 doses and have initiated the full immune response. The main concern is whether people could get asymptomatic infection and be able to transmit to other people. But this is why it's so important that we get very high uptake of the vaccine, because if we get the majority of the population immunised against, not the majority, 80, 90% of the population immunised against COVID-19, the virus doesn't have the chance to spread through the community as it is currently able to. So we'll actually see lower levels of transmission the more people who get immunised. The challenge we've got, of course, as Gili and Eyal was saying, is that we don't yet have a vaccine for children. So at the moment, we can't vaccinate 20% plus of our population, but it looks like those vaccines are coming down the track.
Right. And in many countries overseas, they use these rapid tests. Do your own swab, you put it in a solution, then you drop it on a cartridge, a bit like a pregnancy test. And 15 minutes later, whoopee, you know. So we don't use these at all. Can you explain to us why we don't have rapid testing in Australia?
Yes, so the tests that we use, the gold standard, are the PCR tests, and many of you would have had one of these with the swabs which are used. And the rapid tests, even though they're quite good, they're not as good as the gold standard PCR tests. And in Australia, it's really important that we are not missing any cases of COVID-19. So if you do enough rapid tests on a group of people, eventually you'll get a falsely negative test of somebody who is infected, but the rapid test says that they're not. And so it's really important with the situation we're in Australia at the moment that we are not missing any of those cases, and that's why we don't use rapid tests at the moment. But they may have the utility in the future. In some places, people are getting rapid tests before they're allowed to get in an aircraft, for instance. We're not doing that yet in Australia.
So we all feel pretty safe, you know, and we're walking around and we're going to public functions and we're going on public transport. I mean, we're in a state of we're a rare country in the world. And so the vulnerability is not front of mind for us. And as I said before, what's happening in Europe is that suddenly the variants have taken hold, and the last 6 weeks of progress has been reversed, and the hospitals are being overwhelmed again. This has just happened in the last few. If the variants can take hold in Europe, what's to stop them taking hold here once they get through and people are asymptomatic? How do you know?
Yes, so look, we are concerned about the variants, but what we know, again, is the more people who get immunised, the less opportunity the virus will likely have to be able to mutate and for these new variant strains to start appearing. So again, vaccination is a really good way of protecting us from the development of these variants. We're still going to have to be very cautious with when we lift our borders in Australia and how quickly we do that. We've had the green zone flights between New Zealand and Australia. Of course, they stopped when New Zealand started getting community transmission a couple of weeks ago. So, you know, we are in a challenging situation. Once we've got everyone immunised against COVID-19, hopefully things will be different, but we're following things very closely, seeing what's happening in countries right around the world, seeing what happens with these variants. As Eyal said, though, we do have the opportunity with these vaccines to have them tweaked and to have booster shots, probably in the future, which will protect against these variants if they continue to develop.
So if we're waiting for, when will enough people be, what will it take to open the borders?
Well, I think that firstly, we're going to have offered everybody in Australia the opportunity to get vaccinated, and that's going to take us till at least October of this year by the time we get through all the adult population. And then, of course, we need a vaccine for the children of Australia as well. So I think you know, we're looking at the borders being pretty much as they are while we go through the vaccine program. Also really important during the vaccine program that people don't let down their guard and say, oh, people are vaccinated, I don't have to physically distance, I don't have to be careful, I don't have to go and get a test if I get respiratory symptoms. You do. We don't know where the next outbreak of COVID-19 is going to occur in Australia. If you get symptoms of fever or flu or feeling unwell, you still need to get a COVID-19 test. You still need to stay at home while you wait to get your test results.
In your view, Michael, do you think that there's silent COVID in the community? I mean, in the country at the moment, that's sort of, you know, subterranean. We don't feel it or see it because people are asymptomatic.
I think it's very unlikely in Australia, and the reason for that is twofold. Firstly, if we did have silent COVID transmitting, eventually someone who is elderly would get infected and they would end up in hospital and they would be diagnosed, and we're not seeing that at the moment. The second thing is we're doing wastewater sewerage testing in many parts of Australia, and it's amazing, the tiniest fragments of COVID-19 in the sewerage system can be picked up and detected. We are seeing it in places where we know that there are people who have come into Australia, been in quarantine, been infected with COVID, recovered, been released from quarantine, and while they're recovering, they're not infectious, but they shed the virus. And so we can see from the wastewater where that's happening. But I'd be very surprised if we're having silent COVID in Australia.
I want to ask you another question, because you're in the centre of control centre for the COVID in Canberra, and you know what's going on. In the 2 weeks of in the vaccine rollout so far among frontline workers and people who have comorbidities, have you seen any pushback? Has anybody said to you? Have people said, the frontline workers said, look, we don't need this. Well, I've had COVID, why do I have to have a vaccination?
Well, firstly, if you have had COVID, if you're one of the nearly 30,000 people in Australia who have had COVID-19, you still need to get vaccinated. So please, when it's your turn, get vaccinated. In our aged care facilities, we've had 95% plus of people in aged care facilities wanting to get the vaccine. The only people who we're tending not to vaccinate are those people who are very, very frail and rapidly approaching the end of life, people who are expected to pass away in the next week or so, and we don't vaccinate people who are so gravely unwell. In the healthcare workers, we're seeing very high levels of uptake. We are seeing some hesitancy among women who are pregnant, and again, it's a different situation to Israel because we don't have community transmission occurring in Australia. So some women who are pregnant are saying, look, I'm just going to wait till I've had my baby and then I'll have my vaccine. You don't have to do that. We're not recommending that you don't have the vaccine if you're pregnant, but we are recommending that women who are pregnant have a talk to their doctor, their midwife, their obstetrician about getting the vaccine, because we do know that if you do get COVID-19 and you're pregnant, you can be susceptible to much more serious disease and the risk of premature labour. So it's a matter of balancing the risks.
I also wanted you mentioned in your talk that vaccines available to everybody, and everybody with any kind of visa, and those whose visas have possibly expired because the borders have been closed, and every Australian resident and citizen. But what about what about the people who are in Australia who don't have papers and who are afraid to go and be tested because they have to give their names and they have to be contact traced? And just as they're afraid to go and be tested, so they may be afraid to go and be vaccinated. I don't know the size of the undocumented migrant population, but I do know Australia hasn't had an amnesty for 40 years. Do you think perhaps it's time for one?
Well, look, one of the things that we know about public health measures is that when you've got a pandemic, you don't restrict the vaccine just to your citizens. You make it available to every person who is in your country, because the next outbreak may occur in someone who's not a citizen. So
if I was an undocumented migrant, if I was an illegal immigrant or an undocumented migrant, and I want to have a COVID test, but I haven't got a Medicare card, I've got a mobile phone, I've got a number, and I've got an address. What can I do? I don't want to, it's a risk.
Yep, well, we do have clinics where people who don't have Medicare cards are able to go and get their medical services. We have clinics which are set up to look after people seeking asylum, people who are here seeking refugee status, and others. And these people, of course, don't have Medicare cards in many situations. So you're right, we want people to be able to get the vaccine, and we don't want to be putting up barriers. You know, there are Australian citizens who don't have Medicare cards as well, Jill. There are people who don't have them, and we want everybody to be able to get the vaccine.
Right, and Michael, you've been in infectious diseases for a long time, and you've been a doctor for a long time. What sort of impact do you think this whole COVID-19 pandemic is going to have on our national psyche?
Look, I think that's a really important question. The experience we know from past serious epidemics in other parts of the world is that often you get a very long tail of the mental health impact of the pandemic. And this is why the Australian government has put a lot of resources into boosting mental health services right across the country, and also to organisations which provide support to the population, Beyond Blue, the Black Dog Institute, Lifeline, and many others. Because there is going to be a long impact. Many people have had their lives disrupted. Many people have lost their employment. Many people have been in isolation for a very long time. Some people are afraid to leave their own homes because they're vulnerable people. They've been very anxious about going outside their front door. We know the impact on people in aged care facilities, particularly in Melbourne, where the 3 lockdowns have occurred. Many people have been separated from their loved ones. So we do expect a significant tail of mental health concerns. And it is a really important message for everyone online. If you are feeling depressed or anxious or extremely worried, please reach out and get help and support, because help and support is available. And it may be that you're feeling okay now, but it may be in 6 months' time or 12 months' time or 2 years' time that the things start to catch up with you and you need to get that support.
Michael, thank you very much for that. Thank you for your time tonight, and we really appreciate it. And I thank the other 2 speakers in absentia. Thank you to Rabbi Castell. Thank you to House JNF, and I think we'll close now. We've used up all of our time.
We'll ask Dan Springer to close the evening. Thank you so much, Jill. That was amazing. And thank you, Michael, and really all the speakers. Wow, fantastic. Thank you. Dan.
Well, thanks, Jill and Rabbi Castell and everybody. It's very late, so I'll wrap up very quickly. On behalf of JNF, I want to thank our panel for a very informative and very important session tonight. Just some historical perspective, this year marks 120th anniversary since JNF was founded by Theodore Herzl in 1901, and during the last global pandemic, the state of Israel didn't exist yet. And JNF was already developing the land and establishing the universities and infrastructure to solve many of the world's challenges, which, as today's discussion suggests, these institutions are still addressing with colleagues around the world, including Australia. So I just want to thank all of our partners, all of our supporters. We're going to have a number of events this year to mark this special 120th year and our ongoing mission to develop Israel, particularly in the Negev. And just thanks everybody for a very informative discussion tonight.